Why is the current government shutdown deeply necessary? And why does it actually relate to public safety and crime? My name's Emily Galvin-Almanza, longtime public defender and author of the upcoming book, The Price of Mercy. If you've been following this, you've probably noticed many things relating to our safety that are coming out of the shutdown, like when you read stories about air traffic controllers calling in sick, as the president threatens to not offer back pay to those essential workers who are continuing to do their jobs, keeping us safe while the government is shut down. But that's not actually what I'm talking about. The issue of safety and crime that I'm talking about is much more basic. It actually stands at the crux of the current crisis. If you've been following along, you've noticed that the government is shut down because Republicans would like to pass a continuing resolution that preserves the status quo. And what does the status quo do? The status quo allows for the expiration of certain tax credits. Those tax credits that were designed to make the Affordable Care Act's premiums much more affordable for individuals and families who need to be able to pay for their health insurance. Democrats are insisting on a measure that would keep those tax credits in place. Because if we don't do that, people's health insurance premiums on the marketplace may more than double when those tax credits expire. So it's really a very simple issue. Democrats want people to be able to afford their health insurance. They want people to be able to receive care. Republicans would like to kind of just maybe allow them to expire, maybe talk about it later. It's completely unclear. And I shouldn't actually lump all Republicans in here because there are some who have a lot of people in their states who are set to lose their health insurance if their premiums more than double. And those Republicans have in fact come out and said, yes, we do need to protect people's access to healthcare. We do need to protect the tax credits that allow people to be able to pay for their health insurance. After all, health insurance, much like safety, is collective, right? When people leave the market, especially younger, healthy individuals, leaving only the people who absolutely cannot afford to lose their coverage in the market, premiums for everyone increase. So what we're talking about here, if we go with the status quo plan, is a world in which everybody's health insurance becomes more expensive and many more people, as many as millions and millions of people, become unable to afford coverage and therefore unable to afford care and at risk of medical debt bankruptcy, a thing that is so deeply, uniquely American. But how does this relate to crime? What a lot of people don't know is that health insurance and healthcare coverage generally is deeply tied to the crime rate. When you think about it, it's actually pretty obvious, right? Desperation breeds bad choices. And if someone told you that your daughter desperately needs a medication and that medication isn't going to be affordable for you anymore, unless you engage in a little criminal activity which could increase your income substantially, what would you choose? As a public defender, I have represented thousands of people. And I can tell you that a lot of people end up in the court system purely because of desperation. Desperate choices a person makes when they are out of money and out of options. And actually, the research backs this up. There was a landmark study from an organization called Alabama Appleseed, a study called Under Pressure, that showed that when people are deeply in debt, this particular study looked at court debt, almost 4 in 10 of those people would commit new crimes in order to pay back old debts. So we already know that things that strip people of their resources and leave them broke and desperate are not great for public safety. They are not great for the crime rate. But healthcare access in particular has been studied. One interesting study showed that in the jurisdictions they looked at, the size of the jail population was more closely tied to the availability of mental health resources than to the actual crime rate. And in other studies that are actually much closer to the heart of this shutdown issue, we see that Medicaid itself is profoundly related to public safety. So back in 2014, Medicaid was expanded. It was expanded to include about 20 million more Americans who suddenly became eligible for coverage overnight. And what's really interesting about that 2014 Medicaid expansion is that it made a perfect natural experiment. In states that opted in to this Medicaid expansion, crime rates dropped by as much as 30%. And that wasn't just like little piddly crimes, like homicide dropped, robberies dropped, arson dropped. It extended to violent crime like assaults and also to property crime like burglaries and car thefts. Drug crimes actually went down the most by 41%. So what we see here is when we expand access to health insurance and health coverage, we see the crimes we care about the most, the biggies, going down. Obviously, an outcome that everybody should want. And the benefits didn't just stop there of the 2014 Medicaid expansion. When people came out of prison into a jurisdiction that had expanded Medicaid that could cover them, they were substantially less likely to end up back in prison after a year. And that's a really big deal because we live in a country where when people come home from prison, somewhere between 40 and 60% of them go back in within the next few years. People really, really struggle when they come home. Now, I can make a whole other video for you guys about why that is and all of the ways in which our systems undercut people who are trying to come home and do well. But the point is, one of the things we can do to help them do well and to help them succeed and reintegrate and build a life is make sure they have health coverage. On the other side, when we're thinking about what happens when you cut health coverage, we don't actually have to speculate because it's been done. The state of Tennessee helpfully broke ground for us in this area of subject matter. In 2005, Tennessee dropped 200,000 people from TennCare, which is the state's public health program. And you know what happened? Crime went up. It went up by about 7%. And you might say, oh, Emily, 7%, like, that's not that big of a deal. That was at a time when crime was dropping nearly everywhere else in the nation. So Tennessee, instead of being able to follow along and take part in a fabulous increase in public safety, actually saw its public safety suffer because it was taking away people's health coverage. So that's a huge factor of what's at risk in this shutdown, something even Democrats aren't talking about that much. They're talking about your health insurance premiums. That's really important. Nobody wants their health insurance premium to more than double. But they're not talking about the fact that if your premium doubles or your neighbor's premium doubles and people can't afford their care anymore, all of us become less safe. Safety, after all, is collective. It's something we've realized in the years since 2020, when a ton of really brilliant interventions from bail reform to community violence interruption and really cool reentry opportunities and restorative justice programs have all worked together to bring us into a period that is one of the safest in history. Crime has fallen substantially, but we stand to lose all of that if bad public policy choices take away the things people need in order to thrive and live their lives and take care of their kids. So when someone talks to you about what this shutdown's about, now you know. It's more than just health coverage. It's everybody's safety. I'm Emily Galvin-Almanza. You can find me on the 5 Minute News YouTube and podcast. You can also find me on Twitter at Galvin-Almanza or at emilygalvinalmanza.com.